We're going to be talking about some aches and pains this morning. I was just thinking about a story. I saw the comedian Martin Short on a TV program a few years ago. He's being interviewed by the host. Now, I remember watching Martin Short in the 1980s on a TV show called Second City. And you don't think about people you watched on TV 35 years ago as being old, but Short was talking about growing a little bit older, and he said, you suddenly realize sometimes just turning in the shower, you can throw out your back. Jeremy Dalley joins us this morning. He's a physician assistant from Trip Family Medicine right here in Twin Falls on Fillmore Street, in fact, on the north end of the city. Jeremy, that story, a lot of people talk about this as we grow older, that, sometimes just to move is going to be a problem, but a lot of these things may be indicative of something other than just age.
No, exactly. I think at some point, like you said, we all have aches and pains, and we get injured, and those injuries heal and improve. But what I'm really wanting to talk about today is are the injuries that or the pains that don't go away, that are always there, that really limit your activities of daily living. Your lifestyle is limited by these pains, and a lot of times there's treatment available to help you with those. It's not just, oh, I'm getting old, I'll have to live with this. And so, sometimes that is the reality of some pains. It's true, but there are a lot of things that we can help with.
We know the one that I think people think of most commonly are people who end up feeling the arthritis in their hands. I mean, you can have it in your knees and your other joints, and it can be debilitating even. But we discover we use our hands so much during the course of a day that because if you may have a problem with your knees, you can sit down for a little while, or take a little rest. But if you're cooking in the kitchen, or you're doing anything at work, or you're typing on a keyboard, and this is what most people do nowadays, you're going to feel it.
Oh, definitely. Repetitive injury is probably one of the biggest, or repetitive motion injury, should say, is one of the biggest problems that we see, whether it's in the hands or the wrists or the knees. Our bones have a limited amount of what's called articular cartilage, the cartilage that lines the bone where they come together, so at the joint. And over time, it's just inevitable that that cartilage will eventually wear away. And once it does, then we're looking at a bone on bone situation, and that's called osteoarthritis. And probably the most common, and most people develop it. I would say all people develop it at some point in their life if they get old enough. And it can be a daily ache and pain that there are some treatments out there for.
Now, when you mention treatments, it's essentially just just you can't stay inactive. You want to stay active because it's better for your cardiovascular health and the like. So, are there injections? What is it that works best when these situations come up?
Yeah, it really depends on the overall issue and the state of the joint. I think the best medicine is prevention. So as you go through your lifetime, being cognizant of how much high impact activity that you're doing, whether it's on the low back or on the knees, up and down motions that are constant. One example that I think of is those who work on the railroad. People don't think about them often as having repetitive motion injury, but the constant vibration of the trains for a lot of people can be detrimental over a lifetime of riding the rails. And so we see people who develop low back, um, basically the discs in the low back wear out over time, and they develop bone on bone problems in the low back, arthritis, and things like that. Um, so choosing your occupation, you really have to take things like that into consideration, because later on in life it can severely limit your ability to do the things that you want to do.
I think about that because that's true. Riding in a train, you don't have the same type of comfort ride you'd have in a large Buick.
That's true.
You're going to be bouncing a little bit more. When my uncle was a long haul truck driver, my uncle Frank, he found this special seat cushion, and it almost had looked like little bubbles in it. But he said because even sometimes trucks back in the 1970s weren't what you'd call the most comfortable rides. But once he put that thing in the seat, a lot of those pains that he was having went away, simply because he was able to cushion all of that bumping on the highway.
Yeah, and there's great ergonomic devices nowadays that help people to do their jobs with minimizing um, injury. You think about the wrist devices that they use to prevent carpal tunnel for people, kind of a soft gel that goes on your wrist where the carpal tunnel is just, next to the thumb there, and you put your wrist on it and it can prevent carpal tunnel. Or, the way that people sweep if they're, a custodian or maintenance. Those things really over a lifetime can make a big difference,
I
having
know
good
that
ergonomics.
I have really heavy fingers when I type, and so sometimes I feel it in the second knuckles. Um, because and I was told that's because I have such I learned to type on manual typewriters,
Hmm.
and now I don't need to type quite so hard. But once you learn that way, and I can literally feel it sometimes when I hit a key, and it's very unnerving. We've got more with Jeremy Dalley coming up in just a moment. Joining us from Trip Family Medicine this morning, it's a pleasant 14 outside. we'll be, we're hoping we're going to be a little higher today than that,
Sure
although
hope so.
it's about time. We've got more on the way. We're talking about joint pain and the like today. If you've got a comment or question, keep us in mind in the next segment of the program. You're listening to Better Health with Trip Family Medicine on Top Story on News Radio 1310, KLIX, and newsradio1310.com. Our guest in the studio, Jeremy Dalley. Jeremy is a physician assistant at Trip Family Medicine in Twin Falls. That's located on Fillmore Street, directly across from the main post office. And Jeremy, quickly, for people who'd like to get in touch with anybody at the office, if they hear something on the air, sometimes they can't always chime in, but if they're looking for a new medical provider, how do they get in touch with you?
Well, first give us a call at 933-4400, and we answer the phone. I mean, you're always going to talk to a person. That's the first thing I'll say. And we have really friendly staff. And if you're sick or hurt, then we'll try to get you in today or tomorrow. That's one of our, big goals for patients. And you can see us on Facebook, and we have a website at tripfamilymedicine.com. And so get a hold of us or get to know us through any of those ways, and even check us out on YouTube. We have all these radio shows posted on YouTube for people to look back at and get some of our medical advice from.
Many, many great topics, too. We've got a caller with us. It's 844. Caller, you're up next on Better Health with Trip Family Medicine. Go ahead. Caller, are you with us? All right. We'll tell them if they're still looking to get in touch with us. Try to give us a shout back at 736-0300. That's 736-0300. During the break, I told a story to Jeremy about many, many years ago. I thought I was having some heart issues, and I was having some aches in my left shoulder blade. And I went to see the doctor, and I went through a battery of tests. And then when they could find nothing wrong with me, they asked me about the mattress I was using at home. And when I replaced it, that went away. That gets back to the ergonomics you're talking about, right? How we use furniture or what type of furniture we're using.
Exactly. Yeah, those things make a big difference because like a mattress, we spend a good portion of our life on that mattress, and it's one of those things that sometimes it's hard to spend a good amount of money on something like that, and and sometimes they're not as big of a priority, but it's a huge priority, especially if you're having joint pain or back pain that could be prevented or improved by improving your mattress. Um, I mean, there's all sorts of good treatments for things like arthritis that we're talking about. A lot of people, they go straight to the ibuprofens and the naproxens, which are very effective. Don't get me wrong, but they're not great for long-term use. And that's one of the things I wanted to cover today is we see so often people come into the office with these chronic pains, and they self-treat with ibuprofen, which is seemingly an innocuous medication. But when you get down to it, the things that we see are blood pressure going up in those patients. They come in and their blood pressure is high unknowingly. That's a side effect of those medications. We see things like ulcers uh, form in the stomach, or gastritis, which is irritation of the lining of the stomach. We see damage to the kidneys if it's been used over a long period of time, and even short-term use of those medications can delay blood flow or decrease blood flow to the kidneys temporarily. So there are some consequences. So a lot of times we if we're going to do something over the counter, we say, well, try Tylenol. It works well for a lot of people, and the overall side effects are a lot lower. We're a lot less concerned about what it can do to you. Other things that we like to talk about, things that we can do for people in the office, if it is true arthritis, We do a lot of injections in the office.
Hmm.
Some people know them as cortisone shots, and we're able to get into the joint, and it's not always successful, but a lot of times we're able to relieve or reduce pain dramatically. And sometimes it's not a lot of mileage that we get out of those 3 to 6 months, but every now and then people will get those, and pain will be gone for years and years.
I was going to say, when we were young, we think we're quite flexible, and we are obviously more flexible. But all of those times we fall down, fall off a bicycle, or get hit on a football field, um, over time, that sort of beating and grinding may end up influencing all of this.
Certainly, I mean, there's definitely a cumulative effect of injury over a lifetime, and I don't think that can be discounted at all. And you know, playing football, like you said, there's a lot of people that talk about their old sports injuries that from high school, typically, that plague them into adulthood and and further.
We have a caller with us. Caller, you're up next. You're on the air with Jeremy Dalley from Trip Family Medicine. Go ahead.
Yeah, you saying all that stuff about Tylenol. What about aspirin? I heard aspirin, if you just take one a day, even if you need it or not, is good for you.
That's a good question. Aspirin, in a lot of ways, can be really good. We use it in patients who have diabetes or heart disease, and it can be protective, basically preventing things like clots from forming, and can help to prevent strokes and heart attacks in some people. It's not necessarily recommended to take in all people, and the dose that we recommend is actually pretty low. It's 81 milligrams or a baby aspirin in those individuals. So it's not something that should be taken just because of some possible health benefits. Um, However, um, it is in the same class of medication as ibuprofen, so taking that too often can have the same risks as ibuprofen or naproxen.
The 81 milligram, I used to buy them, I think, at one of the drugstores where I would go in, and just be these little yellow tablets. They weren't like the big old Bayers. They were tiny in that sense. But a lot of these things, and I think with the ibuprofen, am I wrong on this, that there's concern too about how they react with the liver?
No, not as much. So the liver is really actually the one that's affected most by the liver is Tylenol, and that's just at higher doses. But the kidneys are most affected by ibuprofen or naproxen or aspirin. Thank you for bringing that up. When I thank the caller for that, because I think that's a big concern that we have as clinicians, is making sure that people aren't using those things, um, as often or more often than they should. If there's an indication, the benefit can outweigh the risk, but there are risks with taking those even over the counter medications on a daily basis.
I know that when I worked in the postal service, there were always a lot of aches and pains from working around. I worked in a sorting plant, so when you're pushing around a 1,400-pound cage of mail, or you're unloading trucks on the loading dock, the bags coming in on the 18 wheelers, you sometimes twist or turn, and you end up with an ache from all of that. And I kept a bottle of ibuprofen in my locker, and I wouldn't take it all the time, but I would say I was taking it 3, 4 times a week, and I did that over a period probably of a good 6 or 7 months. Any long term threat from that?
Not necessarily. Usually, the threat that would have occurred, I mean, there could have been some damage to the kidneys, depending on the dose of the medication that you took, depending on, let's say you took it 3, 4 times a week, but you were taking it 2 or 3 times those days, probably the risk would be higher. Um, it really is, that's kind of a gray area as far as, is it a bad thing? Well, you know, if we don't see any evidence of damage to the kidneys on your labs, if we didn't see elevated blood pressure or ulcers or things like that we typically see as bad side effects of these medications, then we may say, well, use it, um, don't use it inappropriately, and we'll continue to monitor. But certainly, it's not something that we like people to take on a really regular basis.
We have another caller with us. And caller, you're up next. Jeremy Daly is here from Trip Family Medicine. You're listening to News Radio 1310 KLIX and newsradio1310.com. At 8:51, we have 17. And caller, you're on the air.
Okay, I was just wondering about fish these days, because of what they're saying about the toxins and stuff that's in fish. And then when we take fish oil and all this stuff, I just wondered what your take was on that.
Okay. Well, there are some fish that are higher in levels of mercury, and and so that's something that we should be conscientious of. Um, a lot of the deep sea fish, I think, are the ones that people worry about a lot. But I'm certainly not an expert in that particular area, and I would say that there's probably not that big of a risk unless you're eating copious amounts of fish, which I would say most of us don't. But if you're eating great quantities of fish, even like tuna, if you're eating tuna every day or several times a day, then that may be a concern, I would say. But for the most part, I don't think it's a big concern. And a lot of fish oils actually purified a little bit. Um, Most of those supplements aren't regulated by the FDA, so it's tough to know the quality process that they go through to meet. They don't have to meet any particular standards. So yeah, there is some concern, but I don't think it's a great concern. Not anything that I would be that would keep me from telling people to eat fish because of um, the good fatty acids in fish are great for the brain, for the nerves, for the cholesterol.
We have another caller with us. And caller, you're up next. You're on the air with Jeremy Dalley from Drip Family Medicine.
Yes. Can you talk to me just a little bit about weight and problems in your hip joint? And I'm not talking about a very much overweight, maybe 10, 15 pounds maximum. What effect can that? I've got major problems in my hip, and I would say I'm 10 to 12 pounds overweight.
Okay. Well, that's a good question. So sometimes weight can play a big role in joint pain. I mean, over the lifetime, you the amount of weight that we put on the joints can wear down the cartilage that we are talking about earlier in the show, and that can lead to arthritis. Um, so there is some correlation there, and we see that a lot in people in the hips and the knees if they're overweight or obese. 10 to 12 pounds overweight, I would be less likely to attribute the joint pain that someone was having to that. I would probably look more at the history. Was there a history of overuse? Was there a history of injury? Um, Kind of look back and see if there's something else we can point to besides the weight. But I wouldn't attribute probably, every case is different, but I wouldn't probably attribute that to the weight in that particular circumstance.
Caller,
Okay. And again, I'm just barely hearing you, but one time I heard Mr. Collins talk just very briefly that he had lost weight, and I was curious as to how he did that.
diet.
And if it did when he did it help him in any medical things?
It did, and I will vouch for that. I feel much better walking than I did, and I didn't realize I had issues. But when I dropped over 50 pounds, it was amazing when I was walking, just how much easier it felt on my knees, hips, and ankles. So I guess I would say in the affirmative, it's a big plus.
Yeah, and I would probably just echo that and say, like Bill said, I think the biggest thing is diet. If you're eating more food than your body needs, you're going to gain weight. If you're eating a little bit less than your body needs, not too much less, but if you're eating a little bit less than your body needs on a regular basis, and most of that is just looking at your calorie intake, if you're eating 400 or 500 calories less a day than your body needs, that's about a pound a week of weight loss. So I would say evaluate your diet. And there's a lot of people out there that have joint pain and aches and things like that they feel like prohibit them from losing weight. And there is something to be said about exercise and physical activity as far as the way that it helps you feel better in general, just your overall health and releasing endorphins from the brain. But you can lose weight just by changing your diet.
My endocrinologist many years ago told me, she said, you can do all the exercise you want, but unless you eat less. And I think that that's something I've taken to heart. It's true. The changes in calories are definitely going to do it. We've got about 40 seconds left, Anything that we didn't get to that you wanted to touch on at least briefly?
One thing that I recommend quite a bit in the office that I think is worth noting and worth mentioning is we we try a lot of times to do things in a natural way as much as possible in our office. We follow medical guidelines and recommendations, but there's so many things out there that can be helpful. And one of those is something called turmeric or curcumin, and it's derived from a root, typically used in Indian cooking. But now it's used as a supplement, and it's been studied medically, and it can be very effective for people who have chronic joint pain. Takes a while for it to come into effect, usually about 2 weeks, but it can make a huge difference, and it's way safer than taking ibuprofen or aspirin or naproxen. And if it helps people to have even a slight decrease in their joint pain, then I think it's worth it.
I use it in a lot of different dishes, just a little sprinkle of it that I now cook.
Man, that tastes good too.
Yeah. Want to thank Jeremy Dalley for stopping by today. The segment Better Health with Tripp Family Medicine. We've got a break for news coming up in just a couple of minutes, and then likely going to be talking Article 5 Convention. What is that in the next half hour of the program? Right now it's 15, and of course, got to remind you as well, there's a slogan at Tripp Family Medicine, life's too short not to feel good. We got through a lot of that today. In the meantime, Fox News is straight ahead.